Hello everyone. Today we are going to be talking about lung cancer. This presentation is being presented by myself, Liza Dahl, Tanya Tren, Kayla Sellers, and Jacob Robertson. So there are two main types of primary lung cancers. The first one is non-small cell lung cancers, and this is the most common type of lung cancer overall. It accounts for 80 to 85% of lung cancers in the United States. And then the second type is small cell lung cancers, and they are diagnosed in 10 to 15% of lung cancer cases. There is a third type called carcinoid tumor, but it is way less common and it accounts for just 1 to 2% of all lung cancers. So non-small cell lung cancer typically grows and spreads more slowly than small cell lung cancer. Both are linked with smoking, but non-small cell lung cancer is also the most common type of lung cancer in younger people and in people who have never smoked. The risks and causes may depend on what subtype of non-small cell lung cancer is diagnosed. There are three main subtypes. The first one is lung adenocarcinoma, and it accounts for 40 to 50% of non-small cell lung cancer cases. The second subtype is squamous cell carcinoma, and that accounts for about 30% of all non-small cell lung cancer cases. And then the third subtype is large cell lung cancer, and it's responsible for about 10%. Small cell lung cancer is typically an aggressive, fast-growing cancer. It is strongly linked with smoking, although other factors including radon exposure may be involved. The two subtypes of small cell lung cancer are small cell carcinoma and combined small cell carcinoma, and that's when the cells mix together with another type. So we're going to be talking about different types of treatment and therapies. So lung cancer is treated in several different ways, depending on the type of lung cancer and how far it has spread. People with non-small cell lung cancer can be treated with surgery, chemotherapy, radiation therapy, targeted therapy, or a combination of these treatments. People with small cell lung cancer are usually treated with radiation therapy and chemotherapy. So surgery is the direct removal of cancer tissues, or sometimes it's called a lobectomy. The direct removal and mitigation of cancer. Procedures leave patients with long-term respiratory sensitivity and breathing difficulty. And then there's chemotherapy, which is using special medicines to shrink or kill the cancer. The drugs can be pills you take, or medicines given into your veins, and sometimes it's both. And then there's radiation therapy, and radiation therapy may be used preoperative or in conjunction with chemotherapy, depending on the stage of care. It's effective in reducing size of tumors. And then there's targeted therapy, which is using drugs to block the growth and spread of cancer cells. And the drugs can either be in pill form or through your veins. You will get tests to see if targeted therapy is right for your cancer type before this treatment is used. And smoking cessation is always used in conjunction with lung cancer treatments.
Symptom management. Lung cancer affects people in different ways. You may have general symptoms of not feeling well, or you may have specific symptoms related to your lungs or to other parts of your body affected by the cancer. Common symptoms for people living with cancer include breathlessness, tiredness, fatigue, coughing, pain management, constipation, weight loss, or loss of appetite. In this section, we will share exercises which may help relieve your symptoms and improve your quality of life. Breathlessness is often relieved by breathing techniques. Breathing techniques include pursed lips breathing, diaphragmatic breathing, and expansion of the lower chest. Sitting, leaning forward, and upright is always recommended for lung cancer patients, but it is important to do what is comfortable. Some tips for breathlessness relief include using an electric or handheld fan. Avoid having too hot showers or bath, as steam can affect your breathing. Take your time, as rushing will only shorten your breath more. Keeps room well ventilated. Avoid too much bending and stretching by keeping items you use frequently within easy reach, and if you are a smoker, stopping smoking will improve your breathlessness. Swap heavy shopper bags for a shopping trolley or rucksack. Try to do light exercises such as swimming, walking, yoga, and Pilates. For cough maintenance and hoarse voice, drink plenty of water, drink warm honey, breathe in controlled steam, and sit upright. Pain is usually managed through analgesics, and keeping a diary of pain triggers may be important in pain management. Swallowing may become difficult, and thickened liquids such as smoothies are recommended. Dietary teaching. Most nutritionists recommend sticking with a balanced diet of lean proteins, fruits, vegetables, whole grains, and low-fat dairy, as well as avoiding sugar, caffeine, and salt, and alcohol. There is no special menu plan that will cure or even treat lung cancer. Instead of thinking of foods such as cancer fighting, it can be helpful and maybe less overwhelming to step back and think about getting good overall nutrition, says Alicia Romano, a registered dietitian at Tufts Medical Center and a spokesperson for the Academy of Nutrition and Dietetics. Eating a well-balanced diet has the potential to aid in treatment tolerance, maintain strength during treatment, and speed recovery, she says. Eat enough protein. Protein sources include eggs, low-fat dairy, milk, yogurt, cheese, nuts and nut butters, beans, soy foods such as miso, tofu, and edamame. Colorful fruits and vegetables add powerful antioxidants and phytonutrients to your diet, which can help ward off cell damage. You need carbohydrates to keep your energy. Include healthy fats. All fats aren't created equal. Omega-3 fatty acids and other healthy fats help support your brain and nervous system and reduce inflammation in your body. Since some foods have higher risks of becoming tainted with bacteria, you should also avoid raw foods and fish. Appliance needs and management. Stage 4 includes cancers that have spread to areas beyond the chest, like the brain. Stage 4 cancer also includes people who have fluid collection around the lungs, called a malignant pleural effusion caused by the cancer. Following lung cancer surgery, the tube will be left in place until only minimal drainage remains, often a period of 3 to 4 days. People who have a disease such as cancer may need a tracheostomy if their disease is expected to soon cause breathing problems. During a tracheostomy procedure, an opening is made in the trachea windpipe. A tube is then inserted into the trachea through the opening. Suctioning may be needed for these patients, as well as extensive physical therapy. Oxygen is commonly prescribed for lung cancer patients with advancing disease. Indication includes hypoxemia and dyspnea. Reversal of hypoxemia in some cases will also alleviate dyspnea. Oxygen is sometimes prescribed for non-hypoxemic patients to relieve the symptoms. Oxygen devices may vary by patient.
Neutropenia itself may not cause any symptoms. People usually find out they have neutropenia from a blood test or when they get an infection. Some people will feel more tired when they have neutropenia. Your doctor will schedule regular blood tests to look for neutropenia and other blood-related side effects of chemotherapy. For people with neutropenia, even a minor infection could quickly become serious. While taking chemotherapy, sometimes your neutrophil level does not return to normal fast enough, or you develop neutropenia. In this case, your doctor may take certain precautions, including delaying the next round or lowering the dose of your chemotherapy, recommending antibiotics during longer periods of neutropenia to prevent infections. If you have neutropenia with a fever, your doctor may give you medications called white blood cell growth factors. Patient education. Patient education varies by the patient, but may include taking medication as prescribed by the provider, managing the side effects of chemotherapy and breathlessness, having a support group for doctor's appointments, asking questions, keeping an emergency contact list. Bathing may help. Chemotherapy will likely be needed. Smoking cessation is a very important part of patient education, and helping them understand the staging and pathophysiology behind their disease and the lung cancer itself. Physiological issues. A cancer diagnosis can affect the emotional health of patients, families, and caregivers. Common feelings during this life-changing experience include anxiety, distress, and depression. Roles at home, school, and work can be affected. You might feel like others can't truly understand. Friends may have retreated. You might find emotional support in counseling, a support group, or a faith community. It is important to accept the 5 stages of grieving and coping. People who have cancer may find that physical, emotional, and social effects of the disease to be stressful. Those who attempt to manage their stress with risky behaviors, such as smoking or drinking alcohol, or who become more sedentary, may have a poorer quality of life after cancer treatment. In contrast, people who are able to use effective coping strategies to deal with stress, such as relaxation and stress management techniques, have been shown to have lower levels of depression, anxiety, and symptoms related to cancer and its treatment.
To create a comparison, we wanted to look at what it would look like if a patient got a lobectomy and how the different topics we covered would all relate to each other. So in a lobectomy, a person will likely need a chest tube for 3 days. So postoperative lobectomy for lung cancer will require a chest tube for 3 days. This will affect symptom management, as the patient will be more likely breathless without lung presence. Also, the patient may experience body dysmorphia and increased coping needs associated with the hospital admission. Also, from my own experience, people with a chest tube, they have to carry around a large container. They have a lot of nursing care, probably are getting lack of sleep and breathlessness. So all these symptoms that keep adding up, which is always very individualized in care, need to be addressed throughout their care at the hospital. And if they have to go home with a chest tube, which hopefully is unlikely for them. At home life, though, symptom management, there's a decreased activity tolerance may occur. Work and other activities may be difficult. So now we're not looking at appliance needs, but we're also just looking at these direct symptoms that come from having a chest tube or a lobectomy. The person literally has less of a lung, so they're unable to breathe at this point. They may not be able to return to work if they have a blue-collar job, which requires them to, or even a white-collar that requires them to do a lot of physical activity. Possible side effects include breathlessness and poor oxygenation, so maybe now they need oxygen at home. There's just a lot of different side effects, but hopefully the lobectomy cures their cancer, and it's more of a time where they can increase their aerobic activity slowly by doing physical therapy and different breathing techniques and getting back to full health. There's going to be a huge psychological coping in our third and last comparison here, that stress management is going to be very important for this person. They're going to be anxious, they're unable to breathe all the time, they have less of a lung, they're maybe experiencing body dysmorphia from having a chest tube. Going to the hospital is also a humbling experience. They may not be able to use prior psychological coping mechanisms like smoking, especially in lung cancer patients, because smoking is the number one reason why people have lung cancer. They may not be able to do that anymore. They're going to have that breathlessness. They may feel and look different to other people. So all these things need to be addressed, and I think the best thing as a nurse in this situation is to provide therapeutic communication, provide encouragement, and really try to stress that they can return to baseline or some normalcy in life, and just give them hope, basically, not by untherapeutic means, but by reinforcing the physical therapy, medications, and the overall goals in treatment. So finally, I wanted to address our concept map. So we try to keep the concept map relatively simple. So we focus on symptom management, which overall is just reducing breathlessness and pain. For the dietary teaching, we looked at they're going to need probably a high calorie, avoid any kind of infection risk in their diet. We're looking at mostly patients who have chemo, otherwise lung cancer isn't affecting diet as far as besides just basic antioxidants, prevention, no high fat, just overall healthy eating at this point. Unless it's a chemo-related diet, and then we're really looking at, and again, for healing, high-calorie, healthy options. They may have a trach if the lung cancer metastasizes, usually stage 4, stage 5 patients. They're going to be dependent on complications, because also that chest tube may come into play, lobectomy. It all depends if there's a pleural effusion present, especially in stage 4 and stage 5 patients. All depends. Neutropenia management, again, for patients who are going to be going through chemo, usually they're going to probably need some antibiotics. They're going to need to wash their hands, raw food. We just said chemo changes just to keep it simple. That, like earlier we addressed, it's going to be dependent on the care that this patient receives. And lung cancer, lobectomies and removing the cancer surgically is also an option. So as far as teaching for devices and surgical interventions, we're going to be smoking cessation is always going to be number one, proper diet, lobectomy, and then psychological issues. Again, we just discussed pleural effusion, metastasis, difficulty swallowing are going to be all issues, and breathlessness. Again, trying to keep it simple. Impact of therapies, it's going to be chemo versus surgery. Chemo is common just because it's a direct route. It's good for earlier stage cancers, and especially surgery is also a good option, but it also will leave that patient in the state where they have less of a lung. Lobectomy is really the major surgery for lung cancer, so that's a lifetime decision. All right, well, I wanted to share our references and thank everybody for watching. We appreciated to share with you in this format about lung cancer, and if you have any questions, welcome to discuss things in the chat. Thank you.